And so anyway, in this document, there's a section called Lockstep, and it's talking about possible government responses to a pandemic. And what they were talking about in that document sounded identical to what lockstep was lockdown was turning, not lockstep. Lockdown was sounding like authoritarian, top-down rules and regulations about what people can and cannot do, restrictions of what you would normally consider to be your freedoms. And I really value my freedom. Yeah. That's basically where I'm coming from. I'm not political.
But was there something specific that's occurred where you thought this doesn't add up with? So you have a parallel with lockstep and lockdown, but lockstep could just be a plan for an eventuality that we're experiencing now. So at what point did you face something that you could say, something tangible, you could say, well, that doesn't make sense, or that doesn't add up with the data that I'm seeing? Was there some kind of realization that something was not quite right?
The first thing was the way they were coding and counting deaths. It just seemed to be that if it's a real pandemic and it's really deadly, you don't need to change how you count deaths, because it's going to be really obvious that they're dying of the thing, whatever. And if it's a really deadly pandemic, you're going to know that anybody who's dying, if they're dying from the pandemic or if they're dying from a respiratory condition, it's going to be really obvious because it's deadly, isn't it?
So how did they change? How did they change, and when did they change the way that they're counting deaths?
Well, they made it into a thing called a notifiable disease.
What was this a law?
It's a public health. I'm not too sure what the word is, and I'm not really an expert on this, but basically, what it really means is that doctors have to put COVID-19 if they suspect it. And that gets counted as a COVID death. And it's completely different to the way deaths are normally coded and counted. You don't normally say somebody's died of flu. You would normally say they've died of pulmonary something or other. But now you're saying, so there's a diagnosis code for COVID. And I would say that somebody who's got COVID is kind of, you know that they have because they've got the breathing problems. But what we find is people are being tested after their death.
Can you do that?
Yes, you can. People are being tested after their death to determine whether they test positive for COVID. Now,
is that normal practice for other deaths? Like flu?
No, as far as I know, you
flu
would.
Deaths.
Yeah, you know. Why would you test somebody for something? Well, you'd have an autopsy, say, in some cases, but I don't see why you'd give somebody a blood test to say that they had some kind of coronavirus after they died.
Are you aware of the Coronavirus Act, in which they changed some of the stipulations you're talking about there? They actually changed the law so that a single doctor could account for the death. The doctor didn't have to see the patient. And
all those things together. So it was kind of like a tsunami, one after the other. So it's first of all the counting of deaths, then the Coronavirus Act, which just seemed like they were saying, well, this is necessary. And a lot of people don't read the small print, but when you read that only one doctor has to sign, it doesn't have to be the doctor who even saw the patient, it can be some random doctor. You can put suspected COVID even if you didn't see the patient, and it will be counted as a COVID death. And it even says in the statistics, these are people who died of COVID and were suspected to have COVID.